if 2,500 people of those 5,000 have back pain, why didn't they answer the ad? It's the question we never ask. Okay, so you put an ad out and you said, if you have back pain, we can help you. Say you're just dropping postcards, and let's just say 50% of the population have back pain. I think we can all go, okay, that's a number we can have, right? So you drop the 5,000 postcards to that demographic of 40 to 75-year-old in the income bracket that would have income to pay for your services. Statistically, you should have 2,500 phone calls because you dropped 5,000 postcards, but you don't. You get 20 people who respond. You go, this doesn't even make sense. If 2,500 people of those 5,000 have back pain, why didn't they answer the ad? It's the question we never ask. I'm going to actually tell you a quick story here. Let's talk Mr. Smith, okay? Mr. Smith, he's 60 years old, right? He's married. His daughter is pregnant. It's going to be his first grandchild. He cannot wait to see this grandchild. She gets more pregnant, the months pass, and he's, I hope it's a boy because I'm going to teach him to fish and I'm going to watch football with him. Super excited. Time marches on, and his daughter is now 9 months, and she calls up and she says, Mom and Dad, I'm going to the hospital. I'm going to have a baby. And they're like, woohoo, super excited, super excited. So they go to the hospital and they wait outside, and the baby is born. And don't you know it, it's a boy. So he's holding the baby and he's saying, I'm going to teach you to fish. And he's just so excited. And all the way home, he chats with his wife. I can't wait for this baby to grow up. Well, about a week later, his daughter says, you know what, Dad, listen, we realize that we need 2 incomes to maintain our household. We actually do. But I don't want to put the baby in daycare. Would you be willing, you're retired, you're home, would you be willing to watch the baby if we set everything up at your house? And he goes, yeah, absolutely I will. And so the daughter thinks it's great. They set him up, he's good to go. And month 2 goes by, 3 goes by, 4 goes by, and the world is great, right? Somewhere around month 9, the daughter comes home from work to pick the baby up, and the baby has a little knot on his head. And she says, Dad, what happened to the baby? And he goes, oh, he was crawling, and we have that little step down into the living room, and you know how bad my knees are, or how bad my back is, whatever the ailment is. And you know, I was chasing after him, but he's fine. I know he knocked his head, but he's fine. Your mother checked him out, and he's good. And the daughter's, okay, all right, good. Packs the baby up, goes home, says to her husband, I don't think Dad can watch the baby anymore. He's had that back problem for a really long time. His back problem's not going to get any better. But the baby is going to start crawling faster. And he's got steps in his house. I feel like the baby could really get hurt. It's time for daycare. So they go over that Sunday and they break the news to Mr. Smith that the baby is going to go into daycare. He's devastated. He's just devastated. He doesn't, no, I'll fix my back. I'll handle it. No, don't do that. And she says, we've decided this is what's going to happen. And that baby goes to daycare. And Mr. Smith is distraught. And Mrs. Smith says, I remember seeing that Facebook ad, whatever it is, this place around here helps people with back problems, and you've had a back problem. Where is that? Where? I got a call. And Monday morning, the phone rings, and your front desk answers and says, ABC Medical Center. And he says, I need to see somebody because I need help with my back. And you say, great. And you schedule him to come in. Now, Mr. Smith will arrive, and he will probably never tell you about his grandchild. He will never tell you about any of that. He's just going to say, I need to handle my back pain. What he's going to say to you, right? Now, if you get that story there, you put an ad out, do you have back pain? 20 people answer the ad. Here's Mr. Smith, one of those 20 people. And those people show up, and they just say, if you can fix my back pain, I'm good. I've had it for 20 years. I just decided today to fix my back pain. But we never ask the question, why? And I'm going to tell you a little story, side story, another story, and I'll come back to Mr. Smith, okay? I'm a physical therapist by trade, and I treated patients for years. And for years, I did intakes on patients. And as a physical therapist, you want to know how long they had the problem, what they tried for that problem, everything that they've done in the past for that problem, right? And the one thing I know for sure is this, okay? We used to call these the doors of life, okay? If you imagine a baby, okay? Imagine hey, Mr. Smith's 9-month-old granddaughter or grandson. That baby is going to be jumping off the couches, right? So you imagine every door to life, and I talk your physical life, is open when you're a baby. And as you get older, you're 7 years old and you have a terrible fall off a bike. You didn't want to ride a bike anyway. You shut that door. I don't need to ride that bike. Okay, that's fine. Now the 7-year-old's not riding the bike anymore, but that's no big deal. His friends don't ride bikes, that's fine. So he moves on in life, right? Then he has something happens skiing, right? And he's, I don't need to ski anymore, right? But as somebody gets older and older, what happens is their body begins to hurt more, they injure their area. Things happen and they say in their life and they say, I don't need to do that anymore. I don't need to walk in the mall anymore. I don't need to do this anymore. But the one thing I know for sure is this. Anybody, you send 5,000 postcards out for back pain. 2,500 people have back pain. And 20 people answer it. I am 100% confident those 20 people have some door in their life that they have their foot in and they say, no, I will not let this door close. I didn't mind every other door prior to this closing, but I refuse to allow this to happen in my life. And in Mr. Smith's case, he refuses to leave that baby in daycare because his dream was to fish with this baby and to be able to show him football. And if that baby's in daycare, he can't do that. So he calls your office and says to you, or says to your staff, I need to handle my back pain. And when Mr. Smith comes in and says, I just need to handle my back pain, nobody finds out what that door is that's closing on his life. Nobody finds out what is motivating him to come in that office. Because if it was back pain, he's had it for 20 years. He would have done something 20 years ago. Back pain is not motivating Mr. Smith to arrive in your office. It's the fact that he wants to babysit his grandchild and his daughter is putting that baby in daycare. And that is what motivated him. I know for sure as a PT, and I know for sure having owned chiropractic clinics with my husband, having run clinics with him for years, every patient that shows up in your office, every patient has some door in their life that's trying to close. And they're coming to you hoping that if they just say, hey, listen, if you handle my back pain or my neck pain, I'm good to go. That's what they're asking for. But if you can actually discover what is that thing, what is that actual thing that they want to be able to do, and this is how you actually handle someone's problem for life. Because let's use Mr. Smith. If Mr. Smith walked into an office and said, hey, I got back pain, can you just help me with my back pain? And the office said, okay, how long have you had it? All these questions, right? And then they said, okay, we want to treat you and we think it's going to take 8 weeks. We want to see you 3 times a week for 8 weeks and get your back pain handled. You know, after 2 or 3 weeks, the pain is already subsiding, right? So in his head, if he gets rid of his back pain, see, he's going to connect the dot. I can babysit my grandchild. There's an actual missing link, okay? And that missing link is he's had the problem for so long, okay, that his body is debilitated. So even if the pain goes away in that low back, first of all, we know it's coming back because we know for sure that if you just take somebody's body down below the pain threshold and then you put them back to some physical activity, it's coming back. So you didn't actually solve his problem. And if you actually look at Mr. Smith's history on trying to solve his back problem, that's what has happened his whole life. Is he's pushed it back enough to feel a little better and then it comes back because it comes back. But in your office, it can be solved for good. If you can discover why he's there, what door's closing on him, and then you also, in your workup, explain to him, yes, the pain has to be handled, but the pain is not fundamentally the problem. It's the fact that he probably can't squat down. He probably cannot lift a 20 or a 30-pound bag of flour. Imagine this, okay? The baby is probably whatever, maybe 18 pounds now, but is gonna be 25, 30 pounds. And he's gonna have to lift that child. So if he wants to keep that child out of daycare, not only does he need to back his pain off, but he needs to actually handle his spine, which he's in your office, you know he can handle it there, but he also needs to strengthen that area because what's gonna happen is he says pain is gone, he'll get that baby home again, and then he'll go to pick the baby up and he'll drop the baby because he can't pick up the baby. Do you see what's gonna happen? If we can show him that it's not the pain that's the problem, it's the pain and the function that's the problem, he will exchange money with your office. I believe you can solve my problem. The problem is no longer back pain. Remember, I will tell you probably 95% of doctors' offices run off the symptom. He thinks I'm gonna give you some money, we're gonna get rid of the back pain, and that's good to go. Now he realizes he needs his function back. I believe you enough to give you my money. You convert him, and then you retain him, and you treat him. And that man now, that door that was trying to close, he pried it back open, and that baby is back home. And I can tell you for certain, we've been doing this for 30 years in our practice, there is no question that this system works. The question is, why does somebody actually arrive in your office? Is it because of back pain? Is it knee pain? Is it neck pain? No. It's because the door, one of their doors of life, is trying to close, and they have a foot in it, and they're crying out for help for somebody to pry that door back open to give them the life that they want. And what AMI does, once they arrive, there's an actual conversion process. We have this beautiful process. We call it our day 1, day 2 process, sales process, conversion process, whatever you want to call it. It is a human interaction process that we teach you how to stair-step Mr. Smith through the steps to fully understand how to fully handle his problem. And then he says, here's my money because I believe you. Please help me. And then you go ahead and you help him. So I'm going to tell you this. Now that you understand why your patients show up in your office, click the link below, click the link above. Let us show you how to help you, because when they arrive, it's a simple process to walk them through. 90% of the people are going to choose care in your office, and you're going to change their lives forever. Looking forward to seeing you. Click the link up, down, or wherever the button is.